Hi. So today we are going to go through some corrective exercise strategies for a lateral ankle sprain. We're going to go through the 4 phases of the corrective exercise continuum, which will include inhibiting, lengthening, activating, and integrating. So this first section we're going to cover some inhibition techniques to help our client inhibit some of the overactive muscles that surround the ankle joint. So my client is Doug. He's going to come on in, and we're going to use the foam roller to move through some of these exercises today. So the first exercise we're going to do is we're going to do some myofascial release on the lateral gastrocnemius muscle. So what I'm going to have Doug do is set himself up so that his left leg, the leg that had the ankle sprain, is the primary focus. We're going to begin with both legs up on the roller just for comfort. And what we want to do is just have a slight focus towards the outside of the gastrocnemius or the calf muscle. Okay? Doug's going to draw his belly in, keep his body strong, and then just begin by rolling from the top of the ankle to just underneath the knee and back. And what I'm going to ask him to do is just to pause on any points that might be a little bit uncomfortable. Have him hold there for 30 seconds or until the tension releases, and then continue on to search for the next point. Okay? So Doug, I'll get you to do that. Come on down. So once again, we want to make sure he's comfortably set up with a good posture through the upper body, drawing the belly in. Right? Just a slight focus. I'm going to get him to turn his toe up just a little bit towards the outside of his left calf. And I'm just going to have him slowly start rolling along until he finds a point of tension. And then once he does that, I'm just going to ask him to hold. Did you find a spot there?
Yep.
Okay. Get him to continue to breathe, right? And try to relax through that area. Now if it's quite uncomfortable, again, we want him to hold for 30 seconds. If he can manage a little bit longer, he can hold for up to 90 seconds. But if it's quite uncomfortable, 30 seconds will be lots. Terrific. So normally what we would do is have Doug continue to search for areas of tension throughout the calf, through the lateral gastrocnemius, but we do want to demonstrate the next exercise. So I'm going to get him to hop up. The next focus is going to be through the peroneal muscles, or the muscles that run down the side of the leg. So once again, on his left side, this time we're going to get him to come onto his side, right? Have him stack his feet, and do something very similar, right? So again, lifting the hip if it's comfortable, and then just getting him to slide down the side of his leg. Again, we don't want to roll across the joints, so it's from the top of the ankle up towards the region just beneath the knee. And again, any point of tension, just holding for 30 seconds. Again, it's important here that he maintains a good strong shoulder, a good strong set position, and strong abdominals as well. Give that a go. Come on down. Perfect now. So he can either, if he wants to, if he feels strong enough, he can stack his legs one on top of the other, right? Or if he wants to, he can actually bring the top leg in front, if that gives him a little bit more stability, right? Now, sometimes it's a bit of a challenging exercise, and you might need to move his upper body position a little bit. Again, just searching for areas of tension just through the outside of the low leg. And again, if it feels comfortable, he can stack the legs to apply more pressure. Perfect. And then again, through those points of tension, he just wants to breathe through it. Again, keep the belly engaged, keeping the shoulder in a good, strong, set position. And then continuing to move to search for tender points. Terrific. Right. So the third exercise that we're going to have Doug do is some myofascial release for his biceps femoris muscle. So that's kind of the lateral area of the hamstring. So we're going to set up the foam roller just a little bit higher. And again, comfortable with the hand placement. We're going to start with 2 legs. Right? And again, just a slight turn out of the left foot so we can target the outside of the hamstrings a little more effectively. And just have him roll from just beneath the gluteal fold down towards that area just above the knee. And again, just stopping on points of tension and having him hold that. Down. Now we're using a fairly firm foam roller. If this was going to cause Doug a lot of discomfort, or if this is a new exercise for him, we might go with a softer foam roller and build up to something a little bit more challenging. So again, his belly's drawn in, right? Good strong posture. And we're just going to have him roll back. Again, just a slightly outturned foot to target just through the outside of the hamstring area. And again, any point of tension he could pause on. If he finds that he actually could take on a little bit more challenge, we could have him take his right leg, put it on top of his left to apply more pressure, and then have him continue to go through the process. So again, any tender points, hold for 30 seconds, and then continue to move down the length of the muscle. Terrific. All right, one more exercise to show, and we're just going to do some myofascial release for the TFL muscle, the tensor fascia lata. So this one's a little bit tougher to get to. What we're going to do is have Doug come on down onto the area above his hip, just above the hip bone, and then just have him tip forward just a little bit. Again, top leg can come in front for a little bit of balance. Right? Now this muscle actually extends out into the IT band. So it's actually a fairly short range of motion that we're going to get him to work with. Just a little bit forward and back. Right? So again, he's sort of to the side of his hip and just slightly forward. Again, we're just going to have him pause on any areas of tightness and then continue to roll through. Okay. Come on down one more time. And again, we're doing this all on Doug's left side because that is where he's had a number of lateral ankle sprains. So again, just in front of the hip bone, tipping forward just a little bit. And then just rolling down towards the side of the leg. Again, a really short range here. Perfect. You can actually just extend down just a bit deeper there, Doug. Oh, that's lots. Good. And any tender points again, just pausing for 30 seconds. Now this self-myofascial release, all of these exercises can actually be done every day. Typically we're looking at just one set. And rather than looking at any numbers of repetitions, we're just looking at holding on to tender points for 30 seconds or so. And that's how we inhibit some of the muscles related to lateral ankle sprain. So the second phase of the corrective exercise strategy for lateral ankle sprain is lengthen. So we're going to be looking at lengthening techniques, and we're actually going to be lengthening the same muscle groups that we just did some myofascial release on. So the first exercise we're going to do is we're going to focus on, again, the lateral gastrocnemius, or the lateral calf muscle. Right? I'm going to have Doug come on in. We're actually going to do this stretch together. We're going to find ourselves a wall, right? And taking his left leg straight back. What we're looking for here is that the toes continue to face forward,
so we're going to come
rather than the heel turning
after?
out. So turning the hips forward, leaning in, and drawing straight down, right down into his low
eventually
leg.
after what?
And then we're just going to have him hold this stretch for somewhere between 20 and 30 seconds. Right? I like to have my clients hold the stretch for just a little bit longer. The other guideline we can use is to have our clients hold this stretch just until the point of tension starts to release. Right? So again, we're looking for length down the back of the leg and a hold of about 30 seconds. So the target here again, a little bit towards the outside of the gastrocnemius.
So I'm going to try this again in another.
The second focus, we're going to come a little bit deeper into the soleus muscle. So what I'm going to ask Doug to do is just take that same foot back, take a step in, and what he can do from this position is actually then bend his knee towards the wall. So again, staying grounded in the back heel, foot straight on versus a turn out or a turn in of the heel. Right? Heel grounded, knee bend, and maybe even a slight shift of his body weight towards the wall. Can you keep the heel grounded, then maybe a little more? So again, the deeper calf muscle is our target. Right? We want Doug to continue to breathe smoothly and evenly. Right? Always maintaining good posture and a belly brace. Again, holding this for about 20 to 30 seconds or until he finds the point of tension starts to release through the calf area. How does that feel? Terrific. All right, come on up. Now, the third exercise we're going to do is for the biceps femoris. So we're looking to create a stretch through this muscle. There's a couple of different ways we can do this stretch, and I'll show you the one we're going to use today. We're actually going to start on our backs. Right? Again, we're looking for the left leg. We're going to have Doug elevate the leg. Right? And then from this position, we're actually going to take the leg across the body slightly. So again, the focus is through the back of the thigh. By drawing it across the body, we're targeting a little bit more through the lateral hamstring, right, to create a little bit of challenge there. Right? So come give that a try. Okay, so we're going to have him bend his right knee, extend his left leg up. Right? Again, it's really important here, belly is drawn in. We're looking for the tailbone to come down close to the floor. Right? And we're just going to have the leg come just slightly across the midline of the body, staying grounded through the upper body here as well. Once again, we just want to take it to the point of tension. Right? So if he starts to feel any shaking, we want him to just ease off a little bit. Right? Long breaths. Once again, holding for 30 seconds. Okay, it's really important that he's staying grounded through his hips. So notice that his hips not coming off the floor. It's staying grounded, and we're extending out through the hamstring. I'm thinking about extension from the backside right down to the heel. How's that feel?
Stretchy.
Terrific. All right, release that. Good, terrific work. Now, the last stretch we have, we're going to target that TFL one more time. And what I'm going to ask Doug to do, we're going to stretch him in a little bit of a different way today. Again, we're thinking about that left side where he had his ankle sprain. So we're going to start by taking actually the left leg, or the right leg forward rather. Right? Now sometimes just from this position and lifting up, the target is much more through the hip flexor. We want to kind of get into the TFL a little bit more. So what I'm going to ask Doug to do is just come over right beside me. And he can use me for balance if he needs. Right? So instead of having hips square and leg directly out in front, what I'm going to ask him to do is actually take his foot just slightly inward. And again, he can use me for balance if he likes. So that my knee is almost in line with my front foot. Right, so what that essentially has done is kind of trapped my back leg a little bit. So it's really important not to kind of lose hip focus, right? So nice and straight through the hip, right? And then from that position, we're going to push forward a little bit and extend the arm up. So again, this more closed position between the front leg and the back leg can actually help to target that TFL just a little bit better. Right? And if he needs more engagement, he can actually take just a very slight tip to the side, right, but keeping the hip in a neutral position. Now again, belly needs to maintain its brace here so that no arch comes through the low back. And so everything is tight through the middle. And again, we're holding this stretch for up to 30 seconds. How does that feel? Are we kind of getting into that area a little bit?
Absolutely.
Perfect. Great job. Thanks. So those are our 4 stretches that will help us lengthen those muscles that are really tight in relation to our corrective exercise strategy for our lateral ankle sprain. Okay, so now we're going to move into our third phase of our corrective exercise continuum. And this phase is all about starting to build strength. So it's our activation stage, or our isolated strengthening phase. So now what we're going to do is start to build some strength around the area of the lateral ankle sprain, so hopefully long term we can reduce the risk of chronic ankle injuries. So the first exercise I'm going to have Doug do is something called a towel scrunchie. Right? So what we're going to have him do is take off his shoe, which he's already done, of his left foot. We're going to have him step onto the towel. And then we want him to imagine like he's doing, it's almost like he's going to pick up the towel with his feet. So I don't want him to actually pick the towel up, but I want to imagine that he's grabbing onto the towel with his feet, and then we'll have him release. So what we'll have him do is actually grab the towel, and then I'm going to have him hold it for about 2 seconds, and then have him slowly release for a count of 4. So again, we'll have him do it again. So scrunch the towel, hold for a count of 1, 2, and then have him release for 4, 3, 2, and 1. Actually, lift up your foot, Doug. Let's try it this way. I think that's better or worse. All right, so once again, have him scrunch, have him hold in an isometric contraction for a count of 2, and release eccentrically 4, 3, 2, and 1. Good, keep going, just do a couple more. So what we're going to have Doug do here is a set of 1 to 3, and 1 to 3 sets of between 10 and 15 repetitions. He can do these activation exercises usually every second day, so 3 to 5 days a week. Okay? Initially in the beginning we want to make sure that he's getting enough rest between his exercise days, but eventually as his body starts to adapt, we can go up to 3 to 5 days a week. Great job. One more time, big scrunch, a hold, and then 4, 3, 2, 1. This is an excellent exercise for developing some strength in the feet. Perfect, thanks Doug. So Doug's just going to pop his shoe back on while we talk about the next 2 exercises we're going to do. We're going to do some strengthening work for our anterior tibialis and for our posterior tibialis. So what we've done here is set ourselves up with a tube which has a strong attachment. Right? And then we're going to have Doug have a seat on the end of the table. We're going to hook up his left foot. And again, we want to make sure that this is very secure. Have him shift back just so his ankle is hanging off the edge of the platform. And then, from an extended position, all we want him to do is have him pull up. Again, hold for 2 counts. Then have him release for 4, 3, 2, and 1. Pull up, hold, 4, 3, 2, and 1. So what we're attempting to do here is to strengthen the muscle of the anterior tibialis that runs down the front of the shin. So we'll get Doug to set up here. Come on over and have a seat at the end. Thank you. And again, setting up the handle off the edge of his foot, and I'll actually have him adjust this just to make sure it's nice and secure. Always with tubing, you always want to take care, right, to prevent the slingshot effect. Make sure you're securely fastened at both your anchor point and also at your pull point. So again, we have his ankle hanging off the end. Again, just nice and strong through the center of his body, but relaxed. Right, we're going to start from a slightly plantar flex position. I'm going to have him pull his toes up towards his nose, hold for 2 seconds, and then slowly lower down for a count of 4, 3, 2, and 1. Good job. Pull back again, hold, and then slowly down for 4, 3, 2, and 1. Good. Keep going. So we can adjust the resistance by changing the tension of our band. So initially we want to start with a fairly light or grade 1 tubing, and then eventually progress to a more challenging level. We can also use a cable machine for this very same exercise. Once again, 1 to 3 sets, 10 to 15 repetitions, 3 to 5 days a week. Beautiful. So now what we're going to do is just change the focus from the anterior tibialis to the posterior tibialis. I'm going to ask Doug to roll over onto his side. Again, we're going to remain very well fastened here. His leg, we just want to make sure he's balanced. So he can rest his leg on top, he can cross the top leg over if he chooses. It's up to him. All right, now what we want to do here is start in just a slightly plantar flex position, so a fairly relaxed foot position. And what I'm going to have Doug do is think about everting his foot. So in other words, we're going to have him draw his foot upward and inward, and then slowly resist the tension on the way back down. And our timing is going to be the same. So a 1 count up, a 2 count hold, and then a slow release of 4, 3, 2, and 1. Once again, So these muscles of the low leg do take on most of our body weight, right, during standing, walking, and running activities. So they tend to be able to tolerate a lot of endurance. So we are looking to create strength by choosing a tension on the tubing that's enough to create some fatigue for Doug over 10 to 15 repetitions. Again, if this tension wasn't tight enough for him, we would go with a heavier band. Good, just one more time. Go up and in, and then a slow release of 4, 3, 2, and 1. Great job. I can feel the muscle active. That was great. All right, come on in. So we'll just create some looseness in the tube before we release it, and we are going to use it again here in a short moment. The next exercise we're going to do is have Doug focus on the medial calf, or the medial gastrocnemius. So all we're going to have him do is come over to this step bench. Right? We're going to use a wall for some support. Right? Have him come up, again, working through his left leg. Heel is going to hang off, getting him to shift his weight into one leg. We're going to push, have him lift up through his heel, and then slowly lower down for a count of 4, 3, 2, and 1. Once again, it's important here to make sure that the heel and the toe are lined up with one another, right? So that we're avoiding any sort of inward turn or outward turn, directly up and down to target straight through the center of the calf. Good. Come on up. Good. So again, tight through the tummy, strong through his posture, letting his heel drop just to a comfortable range of motion for him. Getting him to lift for 1 count, hold for 2, and then slowly lower down for 4 counts. Once again, we're just keeping an eye on his range and his movement through his foot, making sure that the heel does not end up turning outward or inward. And we want to target right down the center of his low leg. We're only having Doug do a few repetitions, but ideally one set would consist of between 10 and 15 repetitions. This is also an exercise that over time we can add weight. So if Doug wanted to, as an example, hold a dumbbell or a weight plate, he could also do that to create more intensity. Great job. Great job. All right, come on up. One more exercise to show you, and that is going to be for the medial hamstring. So once again, we're going to use the tubing for this exercise, but you can use a cable, or you can also use a machine. Right, so again, we're going to have Doug set up with the tube, again, sliding his foot through. Right? Again, we're going to step away from our anchor point to create tension. Right? Taking our balance onto the right leg. Again, belly strong. We want to stay stable. Right? A nice neutral spine. We're going to bring the heel up towards the back side, and then slowly lower down for, again, our count of 4, 3, 2, and 1. Again, contract up towards the back side, hold for 2 counts, and then slowly lower. Again, we want to avoid any sort of upper body movement, so we don't want to arch the back. Right, tummy tight, right, hips neutral, and again, that range of motion. Right? So we'll see if we can't get Doug to slip his foot. His left foot in. Once again, with the tubing, very important to check the anchor point, make sure it's secure on the foot. And this one can be kind of tough to set up as well. So he'll have to step back almost with a flexed foot. Perfect. And then wants to come square to his anchor. Okay? And then, keeping belly strong, hips neutral, I'm just going to ask him to bring his heel towards his backside. And then slowly lower down for a count of 4, 3, 2, and 1. Good. Again, hold up. Hold for 2, 4, 3, 2, and 1. Beautiful. So again, we're just watching for the alignment through his knee, right? Making sure that the hip comes straight down through the knee, and that the knee isn't splaying outward or inward. Right? Hips are nice and level, abdominals are activated, upper body strong. Right, just have him do 2 more. Beautiful. One more time. Terrific. Once again, taking some care to release out of our tubing. And those are some exercises that we can do to help with our corrective exercise strategy for lateral ankle sprain. So we're into our final phase now of integration. So now what we're looking to do is integrate full body movement as part of our corrective exercise strategy for our lateral ankle sprain. So the first exercise we're going to do is going to be for a focus through the core, the abdominals, the hamstrings, into the calves and the feet. So I'm going to ask my client, what we're going to do is have him set up on a ball. Okay? I'll actually get him to roll out so that his shoulders begin on the ball. We're going to start with a glute bridge. So the setup here is the feet are about hip distance apart. Really important to check in that the toes are facing directly forward and that the knees are tracking directly over the toes, about 90 degrees at the knee and the ankle. Okay? I'm going to ask my client to draw his belly in, think about activating his glutes, and then we're going to move through a glute bridge where we're going to drop the hips, and then lift the hips by squeezing the butt, pushing into the heels, and then we're going to finish this movement by elevating the heels at the end, and then dropping the heels again, and we'll start again. So hips drop, hips lift, contract the glutes, lift the heels, and then land. Perfect. Come on in, Doug. So the setup with this exercise is very important. So we'll get him to roll out here again, so his shoulders are on the ball. Once again, our alignment that we're looking for are that his knees are about hip distance apart, so just bring him in a little bit closer, and that his toes are facing forward, because again, we want that straight forward and back motion, particularly for the calf. Right? The belly is engaged, he can place his hands wherever is comfortable for him. Right? Then I'm going to get him to drop into his hips. Right? He'll lift his head to keep his spine in line, and then have him activate, squeeze through his glutes, push into his heels to activate his hamstrings as he lifts hips, and then he's going to finish just with a little heel lift and back down. And we'll have him go again. Now he's performing these exercises slow and with control. And as he lifts his heels, we're just making sure that again his knees and his toes are not turning in or out. Perfect. Hips lift like a string's on the inside of your belly button. Beautiful. Drop the heels. All right, just a couple more. So again, we're going to have Doug perform between 1 and 3 sets of this exercise. He can do it 3 to 5 days a week at about 10 to 15 repetitions. Again, the tempo here is really important, slow and controlled. Again, engagement of the core, the glutes, the hamstrings, the calves, and down into the inclusion. Terrific. Perfect. All right, come on up. Now the second exercise we're going to have Doug do is something called a step up to balance. So for this, we're going to need a platform. Now initially we can actually start with no weights, but Doug's done this exercise before, so we're actually going to give him some plates in hand. Once again, our focus is through the left leg, so we've moved from using both legs with the ball bridge to some single leg work now, specifically for the left side of his body. I'm just going to ask him to plant the foot, press himself up to standing, and then come to a balanced position. And then step back again, and we'll have him repeat that. So again, slow and controlled, step, push up and through to balance, and then step down. Funny. So again, as always, we want to cue our client to keep his abs tight, belly drawn in, good strong posture. Once he plants his foot, eyes forward, and then push up, balance at the top, and then come on back down. Just make a little perfect. And then again. Perfect. Keep going. So again, slow, controlled movements. So this is a more dynamic type exercise that are involving more of his full body musculature. Over time, if we wanted to, we could also add in a bicep curl or a shoulder press. But right now, we're just focusing on integrated movement for the lower body. Terrific. Great job, Doug. Fantastic. All right. So our next exercise is going to now be a single leg lunge to balance. So again, we're going to focus on planting his left foot, right, which was his injured side. We're actually going to step forward with his right foot, lunge. Again, make sure the knee tracks over the center of the foot, front knee over ankle, and then we'll have a push back to a balanced position. So again, slow lunge forward, press back and hold into a balanced position, and then have him go again. So again, slow controlled movements. You want him to hold that balance for anywhere between 3 and 5 seconds before he goes again. So again, the focus is creating balance into the injured leg. So he's going to keep his left leg stationary. He's going to start by taking a big step forward with his right leg, drop down, and then push back up for balance. Good. And then again. So again, here we're watching for the knee, making sure it's tracking properly over the center of the foot. We're also watching the back foot as well to make sure that we're not getting any heel turn out or turn in. Also looking for stability around the low leg. So again, more integrated or dynamic training where Doug's actually now using a number of different muscles. And again, with this exercise, we could always add in a shoulder press as an example, or a rotation to create more full body integration. And that would be a beautiful progression down the line. Terrific. Right? And then one more exercise that we're going to do is going to be a single leg squat. So to create some challenge here, we're just going to give Doug a bender ball. This weighs about 5 pounds. Okay? We're going to have him again stabilize and balance on his left leg. Okay? And have him begin just by taking a single leg squat and back up. Now again, what he can do, if he wants to, is he can start to bring the ball down across the top of the knee, and then bring it back up to his shoulder, and then come through again. Moving down towards the knee, creating some multiplanar movement, right? And again, integrated movement through his full body. Again, slow and controlled is the movement. Terrific. So finding some balance. And again, if the balance is a little questionable, what we can do is add the option where Doug can actually keep the toe down to begin. Right? Or we can eliminate the upper body movement to begin. Again, we want to progress this according to our client's abilities and his strengths. Good. Again, belly is braced. We want to keep the hips level and square. Knee tracking over the center of the foot. And make sure our client is breathing as well. One to 3 sets, 10 to 15 repetitions. Again, if this is a new exercise, we may just want to start with 10 repetitions to begin. And we can do it with a frequency of every second day, up to 3 to 5 days a week. Great job, hey? Terrific. So those are 4 exercises that we can do for integrated or dynamic movement training for, again, managing the corrective exercise strategy for our lateral ankle sprain.